Yeah, I think that is probably the misunderstanding, that you see the street drugs that are for like LSD, the hallucinogens that are sort of dependent and causes addiction, the medication that are used in the mental health or psychiatric field, so a psychiatrist sort of a diagnosis and sees whether that person for that period of time might need whatever the medications, even Ritalin. If for some children, otherwise they are agitated, restless, they're not doing the schoolwork, if they find that certain doses of Ritalin for so long, it's not for lifelong, maybe for 5 years the child needs that, and he is more focused, he is more able to work, then the family and the doctor decide that.
If he's more focused, though, but there's going to be other side effects surely when he's at school, other than being focused. Wouldn't he exhibit other side effects due to the medication?
No, I think that is why the Ritalin has a very peculiar kind of effect, that when it is used for these what used to be called hyperactive children, the Ritalin sort of calms the person down, the child down. He is able to socialize better, he is able to do the homework better, he is able to deal with the children better, and for that period that he needs, and then after that it tapers off, and most of them as adults don't need that. So it is prescribed for a particular period of time in a child's life to help him learn to socialize, learn to go to school. And again I said that it should be done with a very clear conscience, with a responsibility, and parents, the school and the doctor, I think they have to work together to see what is the best for the child.
A child is labeled ADD or ADHD the minute he can't sit still for a 10-15 minute period of time, or he talks constantly or ignores the teacher completely. That will get him and earn him an ADD or ADHD label.
The early identification of mental illness is very crucial in treatment. The earlier we catch it, the better we can treat.
But you're definitely not going to catch it by filling some questionnaire that the students will fill it, or the parents will fill it, and the teacher, who's not qualified to any of the above, basically would decide whether or not the kids need some drugs.
We are suggesting that family doctors who do not have that much time themselves should refer to those psychiatrists or psychotherapists who have long time. So I agree with you that there should be no quick checking in 5 minutes and writing a medication to get rid of the patient is, I feel, in any stretch of imagination, is not a responsible practice. But at the same time, I think there is a use of medication in the bigger picture. Just medications, I don't think, for any psychiatric patient is not enough. It should be part of a comprehensive humanistic care, and if at some places it is not done, then obviously that needs to be looked into and it should be investigated, and those are the things. But I feel it will be unfair to say that that minority of people, whether they are professionals or they're business people who are abusing the system, I think they should be watched, and I'm glad that people like you, the media and all that, is keeping an eye on any kind of abuse. But at the same time, public should know that there are many genuine, caring healthcare professionals who care about the families, care about the patients, and we need to find those families, parents should find those healthcare professionals who genuinely care for them and are not there just with a bad conscience or just to make money. But to me, the dialogue like this opens up the debate. People get to know, have a dialogue. This is the only way we are going to offer both sides of the picture, and for public to know what they should get, the type of care from the best people that they can. So I agree with opening up a discussion for people to be more aware, to be more knowledgeable, to be educated, because it is their life. He is suffering, he is depressed, he is anxious. He should not go to the person who does not have a clear conscience and does not treat him with compassion and caring. Then he should walk away. If he's patient number 11, he's not really cared for, and all it matters is to make money and be rich and make your big house and swimming pool and all that, then those families should go to other healthcare professionals who are genuinely, sincerely dedicated to their profession.
It is up to each one of us now to make sure we continue to ask the tough questions and find out as much as we can about psychiatric medication. If there's one thing we do know, it's that we certainly don't know enough. SoulTV.net would like to thank you for watching our series Drugging for Profit. As always, SoulTV.net would love to get your feedback on the story. Feel free to send your thoughts and comments to us. We look forward to hearing from you. For SoulTV.net, I'm Robert Edwards.